Hello, good day, doctor. So I will show you how to prescribe and work in the doctor's dashboard. You can see this is the doctor's admin. This is the doctor's login credentials. I just click sign in. Right now I'm in the doctor's panel. Sorry. So the first thing you do if you are working in OPD, outpatient, that is consulting a patient, you just click on OPD as a doctor or nurse. So you already, if you want to add a new patient, you just click here. If the patient is new, you see you can click new, fill in the form for the patient, all details. So if you want to add anything, you can add it here in remarks here. Like if you want to add something, you can add it in remarks. Then after saving that patient, then you come here. So here we are not adding a new patient because we already have our patient. So we search from here. Let's search once again. Let's search Saadat. We are making all the tutorials with her name. So this is, we already have this patient. She has already showed everything. So here you type in this. You can choose systemic or local symptoms. You don't have to enter every single symptoms. Is it systemic or local? Maybe you choose systemic. Symptoms title, you can even leave this one. So here you describe the symptoms in detail. Maybe you say headache, head. We can choose local. So let's just, it's just headache, fever, vomiting. You can add as many symptoms as you might deem. So if there is any non-allergy, you write it here. If no, you leave it. If you want to add any note, you can add it here. Then you come here, you choose the date. Since this today is 11, so you just choose 11 like this. You write the case. You come here. Is there any casualty? Yes or no? Just no here. This is an old patient, so you click old patient. Reference, if you want to add any reference, because we log into doctor's directory, you see consulting doctor. If it's a nurse, you will also see a similar. We will enter the nurse dashboard later. So you see the doctor is already selected. If there is any TPA, you choose here so that the TPA charges will apply. If no TPA, you leave it. We didn't put the TPA yet. Charge category, let's say GP consultation. Charge type, GP consultation charges. You see the charges will apply everything. If you want to apply any discount in percentage, you can say 1% discount and it will apply. You can add discount, but let's leave it like this. So you see the, if you want to collect the money in cash, you see check, transfer, bank. You can even pay online if we set the online payment method for you, but let's say cash. No live consultation. If the patient is antenatal, you can tick it here. You just click save. Good, this is the patient. All this you can see is the same patient because these are the records of the patient. You can see it, all the visits, 1 2 3 4, all the 4 visits is for this patient. If you add other patients, you will see the list here in OPD, as many as possible. So if you want to check any patient, after saving here, then you come to patient view here. You click patient view. After clicking patient view, you then come here. This is the only patient we have added. That is why you see it like this. But here you will see all the OPD visits, all of them. So if you come here, let's say we have treated many patients. So once you click patient view, you will see them here and you can search the one you want if there are many. But here is only one patient. So we come here, you see, and we click, you can see the cursor. We click this show. So after it has showed, you see this is overview. Here you can see the history. You see all the 4 visits this patient came with. There was a time I did a video vomiting, headache, fever. Here headache, fever, vomiting. So here I didn't enter any symptoms. There was a time I sent the patient for for this thing, for a malaria test. You see, there was a time I added uh, BP just to say a vital. Then look at the symptoms. You see doctor, timeline, everything. So this is the overview. You come to visits, you see all the visits. You come to lab investigation, you see all the labs investigation, anything that you send the patient to do. Then treatment history, you see all the treatments here. If there is a prescription, once you click show, you will see everything. Then timeline, we haven't had any timeline. Maybe you want to ask the patient to come back later. You see, you can choose title, date, description. If you want to add any attachment visible on this person, you just save it. So this is where to add vitals. You see, these are the vitals. Let's say we take the temperature of the patient, although it's in degree Fahrenheit. So we can change this one to degree centigrade in our settings. There in vitals we can change it to since here we use degree centigrade. So let's say we find out that this is the normal range. We find out that the value, the temperature was let's say 96.7 degree Fahrenheit. We choose the date. This is the date and time. We take the reading. We just click save. So this is how to, every vitals you have, this is how to add them. You can see the temperature, it has appeared here. You can delete it, the time and date, you can also edit it. Look at the date, look at the time it was taken, look at the date. This one was on 10th, this one is on 11, you see. So this is how to add vitals. So let's go back to OPD and do some tweaks. So let's say this is your patient and you want to prescribe. This is the ones we add. So here you see, if you want to print this bill, you just come here, click, you see the bill, you see the bill. Let's see the overview of the bill. You see the bill, everything. Just click print and it will print this bill. You see your header, your how we design everything so that it will appear with your hospital details, the letter heading and everything. And it has OPD bill, meaning that this is just an OPD bill. So here you see add prescription. That is where to make prescription. We will go there, but before that, let me show you here manual prescription. If you choose manual prescription, it will come up with the letter heading, name of patient, age, all patient details. Then once you print this, once you click here and print, a paper will appear with your letter heading and you write the prescription manually. You see OPD prescription. So this is the reason for this. If you want to do manual and give the patient to go and get medicine or do something, if you don't have the medicine within your hospital. So this is a show. If you click here, it will show you the same view of the patient. And here, this is where to move the patient to OPD. We also do that. So let's do the prescription. Add prescription. So here, once you come to add prescription, you can add all your prescription here by typing, let's say, paracetamol tab, let's say 500 milligram, let's say BD. Then we can say amoxicillin, let's say tab 500 milligram, let's say BD. So you can type all your prescriptions, but you can't save until you choose a single one here. So here I will change this test to come to something like general medicine. You choose any medicine. Then I have added many medicines for you. Then those interval. So this one you can choose a single one for dummy just to help you save. So here you can type all the medicines, and if you type them, the doctor will be able to see them. If you had something to add here, you can also add in the footer, maybe a note or a description. You can add it here. So let's choose finding first. You see the finding, we choose test. Here we select, I will change this to maybe general finding list, general finding, so that here you can just choose it as dummy. But if you can add all the finding categories, you can go there, add the list exactly, so that it will appear. The medicines, we already have most of them here. What you will do is to come here. This one I will also change it to general category or generic. So once you choose here, you see You see, you wait for the medicine to load, but before then we will add all the dose. Those interval, you'll also change them to add those that will work. Then 3 days. So if you have any instruction, you can write it here for a single medicine. Then you click here. You see medicine has finished loading. Let's write paracetamol. You see paracetamol tablet 500 milligram, tablet 500 milligram. This one is just different companies, but 500 milligram tablet. Let's go down. You see capsule 500 milligram capsule. Then you see another capsule. I want to show you that we have different. You see paracetamol syrup 125 milligram per 5 mil, paracetamol 125 milligram per 5 mil. This one is syrup for children. Suspension, you can see paracetamol suspension. You can see, I want to show you injection. Look at injection. Paracetamol injection. So maybe let's say this paracetamol injection, it doesn't have dose. I don't know whether it has dose or not, but if let's say you find paracetamol injection, you choose here, but it doesn't have dose, you can come here and say, let's say, I don't know how you do it, but it has information if it that you have to enter. Then you just write 500 milligram here, it will appear. So let's say this paracetamol, let's say let's add an antibiotic. You come, you check generic, you choose let's say amoxicillin. You see amoxicillin, you see if there is injection, you can see it different doses. You see, let's choose this one now. So we select BD, we select, we will change this to so that it will reflect a working environment. Here, if to say there is no milligram or you want to add anything, you can add it. Any medicine that you search here, you didn't see it, you can go back to medicines and add it, all its details, or you come back here simply and add it. That is all. So you come here now, you want the pharmacist, you notify, let's say the patient has a test. As a doctor, you have asked the patient to do a test before this prescription. So you choose the test, malaria parasite, you include it in the prescription. If there is any radiology, ultrasound, or any x-ray, you choose it. So here, doctor, you want to notify doctors about this prescription. Pharmacist, you notify them. Let's say you want to notify receptionist, you want to notify nurse. You choose all the people you want to notify that you have did this. If you have anything that you want to add, you can just click here and add a file, an image or whatever. You add it, it will appear here. Maybe an x-ray exam, you can add it. You can write the report of the x-ray exam here. Just write normal findings or something like that. Let's I think let's do something. Okay, let's do something. My goodness, so the file is empty. I don't know. Issue content, maybe I have changed where the folder is. I think I have changed where, maybe the folder is here. Let's, I can't find it. So let's say this is an x-ray exam. You can just pull it in. You write normal study, or if you write whatever it is, you choose all those you want to see this result. You can click save and print. It will save and print. You can also click save. You see, so this is the prescription here. You can view prescription. Just click here. You see the prescription you made. You see the medicine you added here at the top. So you tell them to take note of here. Then you see the medicines you add from the normal dose medicine dose setting. Then you see the malaria. Then you see this one, normal study. So this is it. Then you can print from here. You can also edit this. You can delete it, and you can simply close it. So let's see, now we want to move this patient to IPD. So we click here. So you see, if you want to add anything, when you want to admit the patient, you add whatever you want to add here. Make all your edits. You come here, you write the case. You can even leave it. You can, this is credit limit. You can limit them to spend only 20,000. Once their limit is 20,000, they didn't pay, you stop treating them, but that is not human. So you leave the credit limit as it is. This is as an old patient, you click yes. If there is casualty, yes. No casualty, no. So this one, there is casualty, we are admitting the patient. Look at doctor's name, you see. So you select from here, we will enter all, you go to bed settings and enter all the floors, beds, everything, all the rooms you have, all the wards, everything, you design it. Let's say you write female ward ground floor or something like that, you just design it so that it will appear. So we choose ground floor. So you see here it is loading, no bed. Because I have already assigned the single bed I entered, I should have entered many beds, but it's just for description, it's single bed, and I have already assigned it to this patient somewhere. So you see that there is no bed. So we have to come here and discharge. Look at the patient here. We have to come here and discharge this patient before we have to come to OPD, because I have already admit the patient. So you see, so this one I have discharged her. So here we have to come and discharge her from OPD before the bed will be available. So you come here, you see all the details overview. In that is, if a nurse or a patient, since this one has been admitted, if a patient has a note, you will see it here. Any note that a nurse has added from her dashboard, the doctor will be able to see it here. This is the overview. Then this is medication. If there is any medication, the doctor will add it from here. Since this is OPD, you see, select medicine category, you select choose any medicine, choose dosage, choose everything. This is OPD, IPD, prescription, you add it. This is prescription. You see, you can prescribe for this IPD. Medication is just, maybe you want to bring normal saline, you just click here and ask them to bring normal saline. After it finished, that's all. But prescription is to take medicine long term, so you prescribe from here in IPD, not OPD, after you admit the patient. Consultant register. So consultant register, you can register, you can choose the date, consultant date. You see, you can add instruction as a consultant. This instruction, it will appear to the nurse dashboard. Other doctors, if they come for ward round, they will also be able to see that you register, you came, and this is your report about the patient you checked. Then lab investigation. If there is any lab investigation, you will see it here. Because there is no any lab result, the one I put within the pathologist does not provide the result, that is why you see it empty. Then if there is any operation, you can add, okay, we are doing, you have to go to operation and make all the necessary adjustment, all the necessary changes before it will be working. Operation category, operation name, operation date, you see, assistant consultant 2, anesthetist. You will add everything and you click save. Then the operation will appear here. Then charges, you see, if you want to add more charges to the patients, maybe after the operation, you can do so. Payments, if you want to add any payment, you see, you can do it. You can choose anything you want. Lab consultation, and if they have made any payment, the payment and charges will appear here, but no this consultation. So bed, you see the bed I have applied to active, you see, yes, that is why the bed didn't appear in OPD, because it's a single bed. So we have to discharge this patient. So we click here. This is timeline, you see, you add any timeline. If you have a treatment history, you see, I admitted this patient twice. Here, the first one, which I have already discharged her, then the second one, so I can discharge her now. This is vitals. You see the vitals we entered for the patient. You can delete it, edit it, add, and if the nurse added the vitals too, it will appear here. So this is it. So let's go back and discharge the patient. And we come to overview. Look at here, you see profile. You want to see this patient profile, you see edit profile, you see patient discharge, you see delete patient. So what we do here, you just click discharge patient. You see, we select discharge date and time. Cool. We come to the patient died. Are you referring the patient to another hospital? Is it normal? We have finished treatment. So let's choose normal. You have any note, you can add. Operation, you can add. Diagnosis, you can add. If to say you are referring the patient to another place, investigation, you can add. Treatment home, you can add. And just since it's a normal this thing, we don't have to add anything. So you click save. This patient has been discharged from OPD. So the bed is now available. So let's go back and admit the patient. So here we keep move to IPD because the bed is available. So here, if you want to write anything, make adjustment, make it. Casualty, old patient, yes. Casualty, yes. Reference, if you want to add. So we come to bed type, we select female ward down floor. Bed, let the bed load. You see bed 1, that is the only one I entered. That is why if it is active, you will not see bed, but you will add as many beds as there are available in your hospital. And if you didn't discharge, you will not see it again. So you have to discharge patients in IPD. After you discharge them, you just have to do everything from the software. Then click save. Move patient to IPD. Boom, I have moved the patient to IPD. We were in OPD, so look, we have just come back to OPD. IPD here, you see, we can discharge the patient again. So this is how to make prescription, please. And you can come to this place to add any drug from pharmacy. Pathology, anything you want to add, you can add it from here. Symptoms, you can add as many. Findings, vitals, you can see. Anything that you can't see in your dashboard, you can ask me to tell you how to provide that into your dashboard. Thank you, and I think with this we are done with your work. Thank you so much.